considerations within this population. So for example, let's go on to the next slide. So one of the core values within HIAS, also an action plan, a part of the Action Network, is that refugees are welcome. We want to welcome the refugees and asylum seekers into the United States. And what I really hope you'll take away from this presentation is what that means in terms of healthcare. Obviously, healthcare is extremely important to our way of life and our quality of life. So I want you to consider this as part of a framework of human rights. That's sort of how one of the ways we'll touch upon this subject throughout. So just a little bit about me. Again, my name's Alana. I am currently the Volunteer Services Program intern at HIAS. Like many of you, I served as a volunteer for a couple of years. I was an English language tutor and a cultural orientation facilitator. And I was just really lucky to be able to continue in this role with HIAS. So I'm very grateful to be here tonight. A little bit about me personally outside of HIAS. I'm completing a graduate program at CUNY School of Public Health in Global and Migrant Health Policy. So a lot of the subjects and slides you'll see are course material. Now, I mean, I've developed it, but it's what I've learned sort of in my courses and been able to go into practice more at HIAS. Outside of that, I'm also a healthcare practitioner. I'm a pediatric speech language pathologist. I've worked in New York and Philadelphia over the last 5 years. And I'm just really interested in sort of how healthcare kind of plays into all these communities. So that's something I've been really, fortunate to be able to explore. To do this, sorry. Uh-oh. Hold on one second. All right. So I really want to start off this presentation by discussing definitions. So the majority of the people that we work with will be refugees and asylum seekers. And I kind of want to distinguish what that means. There's obviously I'm sorry, there's been a lot of background noise, so I apologize for that. There have been a lot of other kinds of displaced people. There's stateless people who, sorry about that. So stateless people basically are people that might not have any documents. They might not have a passport or a birth certificate in their own country, or there's internally displaced people, like in Palestine and Ukraine, where they're sort of within their own country, but really don't have a lot of alternatives. They're displaced, so they're sort of migrating within their own country. I want to just focus on the definitions of refugee and asylum seeker. So a refugee is an individual that was forced to leave their country due to religious persecution, threats of persecution, war, natural disasters, and or domestic gender-based violence. So the next part is what I really want you to focus on. Refugee has received this status prior to their arrival in the US or another host country. If you see below, and the reason I wanted to leave the definition the exact same way is because I want to emphasize the fact that an asylum seeker is fleeing usually or leaving their own country for the same reasons as refugees. However, asylum seekers do not arrive at the US or at an asylum processing center with protected refugee status. They must appeal for this recognition after their arrival within a year to the US or another host country. So this will be particularly important when we discuss what healthcare options are available, because you'll see they're very different between these two groups. overall, this is very important to emphasize. Refugees and asylum seekers are protected under international humanitarian law. So two things I really want to focus on in this presentation are, what does that mean, this protection under humanitarian law? What does that mean in terms of their right to health? What do these protections cover? And I hope by the end of the presentation that maybe you all have a better idea of answers to those questions. Okay, so this is our first kind of, I don't want to call it a group exercise, but if you could please use a word or a phrase to describe what health means to you. Obviously, you could pick one of the words within this graphic. You can make up your own. Please, if you would just put it in the chat, we'll take like 2 minutes to review that. I love these words. These are great, important keywords. Shoshana, I love access. That's very important. Physical and mental well-being, a right, more healthcare than health. Great. I like that you're all sort of on the same page, which is nice. All right. Awesome. All of these responses are sort of where I'm going to focus on in this presentation, just to kind of give you a better idea of health is much, much larger than physical health, as we'll see. So let me, and thank you for your responses. Okay. Whoops. I did not share my screen. Sorry about that. Okay. So I saw many of you said the right to health. It's a human right. So just like you said, international human rights law, it recognizes it as a fundamental human right. Specifically, Article 12 of the International Covenant on Economic, Social, and Cultural Rights from 1966 states that the right to the highest attainable standard, it protects the right to the highest attainable standard of physical and mental health. But as you can imagine, health services are organized very differently around the world. They look very differently between countries. And this law, this covenant holds that countries must only uphold this mandate to the maximum extent of their abilities and resources. So when I hear that, that sounds like, you know, countries are really encouraged to adopt protection against, you know, sort of, obviously we're experiencing a major pandemic right now. As a collective security, we should be collectively protecting the planet, you know, against these major health threats, whatever that means from year to year. But if you're a country that maybe does not have many resources, that's kind of problematic. You could have many, many gaps when it comes to protecting people within and outside of your country. So it can be interpreted differently depending on where you are. This is also a very important public health concept, social determinants of health. So as I said, physical health is not the only consideration that we have as it relates to a person's health. Social determinants of health, as you can see, there's many, 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 even more than this. really impact how healthy a person is in the short term and the long term. Um, so what I would like, I'm going to leave this up for a second. If you guys could pick two of these things, so just take a moment to look these over, pick two of these bullet points that you think would be most important to HIAS's client population in terms of if our client population was exposed to this or lacked this, how significantly it would affect their health. So I'm gonna, hold on one sec. I'm gonna bring this back up because I realize now you can't see it. Hold on. Okay, I'll share it and then I'll check out the chat. Okay, so we'll take like 2 or 3 minutes just to, and if you could just write your answers in the chat and I'll come back in a moment. Okay, I'm just going to come out of this to review this all with you. Thank you for sharing your answers with me. I 100% agree. I think number one, socioeconomic conditions. Absolutely. I see there's a lot of people that said socioeconomic conditions. SJ, social support, agreed. Access to healthcare services, access to housing and shelter, language, systemic racism in institutions, especially medical ones. Great point, Eleanor. Awesome. This was fantastic. I mean, if you guys think of something that's not on that list that you'd like to mention too, please feel free to. But I think that's really important to consider for our population, that especially their ability to access social services, their ability to have safe and consistent shelter, their ability to, connect with other people that speak their language, their ability to just, sort of thrive. I mean, that's huge. That would impact tremendously physical and mental health. Thank you so much. I'm gonna reshare my screen. All right. I want to talk about another important public health concept. So the healthy immigrant effect. This was something I even recently learned about this year. So it's a phenomenon that describes how individuals who are migrating from all around the world to the global north, or what previously had been described as developed countries, specifically the United States, Canada, and Australia. There's inconsistent research about European countries. These individuals that migrate from these low and middle income countries to these higher income countries experience better overall health and long-term health than the non-immigrant populations. Um, you know, when I first heard that, that was a little bit surprising to me because they have a lot of times lack of access to social services. They're more socioeconomically disadvantaged. You know, not a lot of times, but sometimes they don't speak the language. The culture is different. But there's some other factors where a lot of these people that have migrated tend to have better diets. You know, they bring cuisine from their own country. They cook at home more. They have more family and community support, which is more important to health than maybe even we think. And sometimes they live within communities that, you know, speak their same language. They can support each other. If someone knows how to access resources, someone else doesn't, there's a degree to which they share that information among each other. And I bring this up because our population, refugees and asylum seekers, sometimes don't have that community support. They've experienced so much trauma in the process of migration or displacement that those healthy effects that they might have, you know, coming to, you know, let's say the United States, because we're in the United States, um, they might be unhealthier than the non-immigrant population because of these specifically negative experiences that they've had. So I think that's another thing that's important to keep in mind. Sorry, I keep losing my prompt tip. Sorry. Okay, so I want to just talk a little bit about, obviously, physical health is paramount, you know, when we think of health, especially during a global pandemic. Let's talk about infectious diseases. So obviously, COVID-19 is a significant concern this year, and it disproportionately affects low and middle income countries. So not only do these countries have to deal with more disease burden as it relates to infectious diseases and communicable diseases, but also non-communicable diseases. So diseases you can't spread between people. So cardiovascular disease, diabetes, stroke, lung disease, cancer, these are all examples of non-communicable diseases. And this statistic is sad. 75% of global deaths related to non-communicable diseases incur in low and middle income countries. Um, you know, it sort of just highlights somehow that, you know, even some of the people that, you know, are now refugees and asylum seekers may already be coming from a location with a very fragile healthcare system. They might already be coming with these diseases, you know, and the displacement process can make this worse. Um, so some of the most common communicable diseases, there's sexually transmitted diseases, HIV and chlamydia being some of the biggest ones. Obviously COVID-19, influenza as well, um, malaria and tuberculosis. These are vaccine preventable diseases, but because there's a lack of access to vaccines in some places or limited access to vaccines, you know, same thing with childhood preventable diseases, measles, mumps, rubella. They're just not vaccinated against them. I was reading an article last night about how even some rarer diseases, you know, I mean, comparatively rare compared with some of these like shingles and scabies and diphtheria were showing up at refugee camps and showing up at detention centers just because of, you know, how poorly they're kept in some ways. And I think when you consider that there's people, you know, there's a 40-person limit in a room and there's 80 people in a detention center in that room, disease is going to spread pretty quickly. So that's, so sorry. I don't know why I keep losing my prompt. I'm so sorry. Okay, so I want to just specifically speak about some of the conditions that may affect this population before they arrive to the host country, specifically in border regions. As we know, we have a pretty contentious situation at the US-Mexico border. There's other borders around the world, Turkey, Syria, the Calais region in France, between France and England. There's, a lot of refugee camps there, and there's a lot of people that, congregate, and there's asylum processing centers, and, just sort of, as I mentioned, some of the issues, infectious disease spread. Um, a lot of times, these individuals are connected with smugglers, human smugglers that attempt to bring them across the border. But, there's a lot of people in this world with very nefarious, intentions. And a lot of human and sex trafficking happens among this population, um, as well as, sorry, as well as family separation. Obviously, that's a really, really big concern at the US-Mexico border. That creates a lot of trauma between families and being separated from their children, parents being separated, families being separated. Short and long-term detainment is another really big issue, especially at asylum processing centers. For example, children are not supposed to be kept more, I believe, than 20 days, 15, 20 days. And sometimes they're kept for months and years. And, that's again, something that would significantly affect their physical and mental health. Um, Another issue, poor and lack of access to mental health and medical services in these regions, which sort of, if you have a lot of people arriving in one space and the goal is for them to be uh, legally allowed to enter a host country, or again, since we're in the United States, you would want them to have health screenings, comprehensive health screenings. And it's not to say this doesn't happen, this definitely does happen. Um, but a lot of times it takes a very long time. And there really aren't a lot of short-term provisions for people that are waiting. Also, especially in refugee camps, poor nutrition, poor food access, very, a lack of really healthy food options for these people. And as you can imagine, this significantly would affect their, health. All right, mental health and trauma. So I've touched on this a little bit. Some of the most significant issues, some of the most common issues would be chronic stress, panic disorder, generalized anxiety, PTSD, post-traumatic stress disorder, depression, adjustment issues, and I'll speak a little bit about that later. Somatization disorder, for example, that would be, a person has maybe difficulty sleeping, or really bad pains in their stomach, or migraines, and really it's due to stress, but it's presenting as physical symptoms. Um, and this population also experiences an increased risk of suicide, which is obviously the most significant of all of those concerns. And why? Why does this happen? I'm sure you all kind of have ideas as to why this happens. Some of the most common reasons are loss of culture, community, and language. Sort of, what you were all discussing in as it relates to social determinants of health. So when you're leaving a country, when you're leaving your family, obviously it creates a big issue as it relates to adjustment, and it's a lot of learning in a short period of time, which can be really stressful for people. Also, the number of traumas that occur during the migration process. So it's a lot of times it's not like these individuals face one trauma. It can be many, many, many traumas. And, you know, when a person experiences a great number of trauma, it's, as you guys can imagine, that it's a lot, their mental health is affected even more so. Um, Kind of as I mentioned before, delayed asylum applications, it can take many years for a person to be recognized as a lawfully present resident. Um, so this would be a significant concern in terms of, that feeling of insecurity over years. Will I have to go back to my home country? Will I be forced to leave? When can I actually settle where I am? Um, Again, and I'm sure we, definitely a lot in the United States, definitely in Europe, a lot of discrimination as it relates to immigrants in general, but specifically, you know, people that are coming here illegally, which is often not a very appropriate term for, as asylum seekers and refugees. Many of them are going through legal avenues to be here, and um, it's just there's a lot of discrimination against these population. Also, living in detention centers or refugee camps for a long period of time can be like a form of prison, imprisonment for some of these people. Just look at the time. So this is a particular population. I work with children, so a lot of the research I'm doing currently is related to experiences of children in detention centers. Um, there's a lot of protections for children, not as many for adults. But obviously, with the family separation policy, which was overwhelmingly negative and had a very and continues to have a very negative effect on children, I wanted to just take a moment and discuss what this particular trauma looks like. So typical development for children when we think about language development, physical development, emotional development, social development, all of that is harmed to some degree when children are, kept, whether it's in detention centers or refugee camps or experience war or any number of traumas that I had previously mentioned. Um, in terms of their brain, in terms of what that actually looks like, their cognition is affected, their intellectual abilities, their ability to trust other people, to trust adults, to trust their family. Social interaction is impacted, judgment. And it's a lot of times this isn't just short term, as we know, traumas that are experienced as children or among children can last a lifetime. Um, and it's not just their mental health, that their immune system is suppressed. They have a greater lifetime susceptibility to non-communicable diseases like stroke, like cancer, like heart disease. They can turn to substance abuse over time. Um, and some of the children that have been in these conditions have been observed to demonstrate regressive behaviors. There have been teenagers that, started to regress and wanted to breastfeed or became incontinent. And, it's really, it's hard to think about and it's hard to talk about, but it's, um, I think it's something that really will be and needs to be more researched, and more policies need to be in place to protect these children. Um, there's, as I said, long-term psychological issues, increased risk of depression, PTSD, and suicide, unfortunately. Um, and I promise there's definitely some more hopeful slides coming up. I'm sorry, I cannot, it just keeps not giving me a prompt to go to the next page, so I apologize. Okay. So I just want to talk about humanitarian work around the world. We'll kind of stay there for a little bit. So humanitarian crises. A lot of humanitarian workers are very significantly focused on um, providing others with access to basic health services. So whether that means establishing clinics around the world, um, you know, giving people access to vaccines. They're also working to provide sanitary conditions in shelters, in settlements, in communities. So these are some of the biggest concerns as it relates to, you know, humanitarian work and humanitarian workers. Um, a big global crisis is climate change. Climate change will create more refugees in the coming decades. It will. And there will be movement between countries. There will be movement from rural locations to urban locations, which will affect sometimes an already fragile healthcare system. So, you know, as many preparations as are being made for that, it's still, you know, and as it relates to public health and global health, it's a major concern thinking about what that kind of forced migration will look like in the future, um, especially when you think of some countries becoming inhabitable. I hope we don't get there, but it's something, you know, we have to prepare for um, as it relates to healthcare. I just want to take a little opportunity to talk about what healthcare looks like in the United States, because you know this is where we are, and it does look differently in other countries. I believe, I think Thailand has like universal healthcare for everybody, including refugees and asylum seekers. Um, I actually don't really know what that, you know, how many they receive compared with other countries, but you know, there, when you think of certain countries that have a lot of um, refugees coming in, like Turkey and Germany, and um, you kind of have to think about sort of what the healthcare system in place should be. Okay, so asylum seekers, until they receive a lawfully present recognition, or a resident, excuse me, lawfully present resident designation, they can't buy into our healthcare system, which can be really expensive anyway, as some of you that might currently buy into the Affordable Care Act. And this is why, you know, obviously this has sort of been in danger in our country anyway. Um, you know, having this option for people is really, really important to not have totally all privatized healthcare. Um, so for this population, asylum seekers in general, their majority of what they can access is healthcare related to emergencies. And each state has money designated. I think it's a couple $1 million, or might be depending on the state, designated for emergencies, that if someone comes into a hospital and they can't pay, that it would be covered. But you know, I guess it can get tricky depending on what's considered an emergency. Um, Pregnancy and immunization support. Obviously, having everyone in a community vaccinated is very important. So refugees can receive certain benefits. The Children's Health Insurance Program, CHIP, refugee medical assistance, Medicaid, temporary assistance for needy families, and refugee cash assistance. So as you can see, once individuals have this refugee status recognition, they have more access to government assistance or benefits. I'm gonna find it. I don't know what this is. I'm so sorry. Mm, sorry. Sorry, it overlapped there. So I just want to, I'm not going to spend a lot of time on this slide because this is like a whole course in and of itself. International Health Organization. So these are some of the biggest organizations that work with refugees and asylum seekers internationally, and highest being one of them. So others, I wanted to highlight others. There's UNICEF, there's the UN Refugee Agency, one of the biggest, or if not the biggest in the world. There's the International Rescue Committee, CDC, Amnesty International. I always mispronounce this, UNRWA. I think it's pronounced UNRWA. It's the last one, works with displaced people in Palestine. So yeah, if you're ever interested kind of in the work and, you know, that these organizations do, there's a lot of really good information on their websites. So, you know, I want to hopefully leave everyone on a more positive note. So in general, this is, you know, I think this has gotten a lot more attention in recent years, maybe in the last 10, 15 years, in terms of improving health. So I want to just talk about, you know, national recommendations, you know, expert national recommendations, and some social recommendations that really would drastically, and again, if anybody has some ideas, please feel free to chime in after I'm done. Okay, so ending family separation practices. That's obviously extremely important. Family reunification as well. Obviously, some of you might have heard the news that there's several hundred families that are still continue to be separated. So bringing those families together is extremely important for mitigating that long-term trauma. Also ending imprisonment conditions. So there is a way to take care of this population, these asylum seekers, these refugees, that's humane and, you know, doesn't expose them to risk of trauma or infectious disease. You know, keeping people in just detention centers in cramped conditions is, it's just not the way to go. So organizing, a recommendation is to organize asylum processing centers almost like campuses. So giving families access to dorms, dorm-like places where they could not only stay together, but, you know, receive medical and mental health services while waiting. You know, and that might seem very like head in the clouds or optimistic, but it's definitely possible. It's definitely possible, and we just have to imagine it and do it to protect people. Also improving sanitary conditions and access to healthy food at refugee camps. Often at these camps, they're allowed to deteriorate. The people in, you know, the government or the local organizations, there's a lot of volunteers and humanitarian workers trying to protect these refugee camps, but sometimes, you know, it's easier for, you know, if a major fire happens, to kind of just let the people find someplace else to go. And it's really, really sad. And obviously improving these conditions would protect people, but also, you know, improve their health. Um, some more social or community-based recommendations, improving community-centered approaches. So recognizing that sometimes, not all the time, members of this population live within targeted communities. They live together, and they share a lot of resources. So understanding where those communities are and doing outreach programs is very important. Also recognizing that public health policies must center on this population. They often don't. So this is, again, sort of what it seems like, at least within the United States, in some parts of the United States, are beginning to recognize that this is a population that is not totally protected and needs more protection. Um, Also developing gender and culturally sensitive material that helps people in the community understand what are the rights of these migrants, what are the rights of these refugees and asylum seekers, instead of kind of seeing them as the other, seeing them as illegal, seeing them as, whatever these less informed people might perceive these individuals or families to be. So having more awareness campaigns to teach and is also a big recommendation. So I just want to open it up to you. If you have any thoughts or questions or feedback or anything, I'm available. And thank you all for listening. Oh, thank you. Thank you, SJ.
Hi, I wanted to say this is Amy Robertson, volunteer with Hearts and Homes for Refugees. Nice to meet you, Alana. And I'm very sorry because I started a little bit late on the presentation, so I missed the kind of about you and your background, but I thought this was an excellent presentation and definitely something that all the volunteers can really benefit from. I don't know, one very specific question, because we talked about the specific diseases, how there's some things that we're not used to seeing. And one thing we've noticed in the community in our area is a lot of boils, and not from poor hygiene. There's not visibly poor hygiene, but people are getting a lot of boils, especially in the first year. I don't know if you're medical, if there's like some explanation for it, if you're a medical doctor.
I had actually, thank you for asking that question, Amy. I think that is something I had heard about. So at least what I know, and I had actually read about this recently in a paper, boils can be induced. They can represent a immune system impact. So when someone has a decreased or a lowered immune system, that leaves them more susceptible to boils. Especially, again, like you said, it might not be that there's a lack of hygiene or poor hygiene, but even, I know that can be very contagious. So it's something possibly, I don't know if these are, newly arrived people that are experiencing this or experiencing it while they're here. But I know, a suppressed immune system could definitely be due to sort of stress and trauma. But yeah, that's an awesome question. Has anyone, obviously maybe without getting too specific, has anyone experienced sort of any of these, health concerns with the clients they work with, or notice that, maybe clients don't understand what their rights are? Anything like that?
Just to add one more comment, I've noticed that a lot of the clients aren't aware of what we would consider standard practices in terms of like how often you would visit a doctor, or whether you would have had your first gynecological exam or that kind of thing. I mean, I think, that can be one thing that's helpful to lay out, just what is our standard. Of course, they don't have to do it, but to have an understanding, because they might not have the same kind of practices at home.
Absolutely. That's a great point. And I think it's important to, I mean, I'm guessing many of you are possibly grew up in the United States or spent a lot of time here, but that's something that's sort of ambiguous to begin with. How often you go to the doctor, unless you have a specific condition and you're being told to go. There's a lot of healthy people that don't go to the doctor that maybe should, as a prevention. Obviously, the United States in particular, it's not really our public health system, our medical system is not really focused on preventive. It's more, you already have a condition and now we're treating it. So this is something that it's difficult to expect um, newly arrived people to understand this when a lot of times people that have been here for many years don't know this information. And I think that's just just a major gap, that exists in a lot of different countries. But does anyone feel like, just listening to this presentation that, there's something we could do right away to kind of help this population? It's something I think about a lot. So if anybody has ideas, please feel free to share.
I have a question. You can hear me? Okay, thank you. I wasn't able to type it in. My
Okay.
question is, in your slides, which were very informative, especially the ones describing sort of the different socioeconomic and mental, physical and mental issues that refugees and asylum seekers face. My question is, to what extent do policymakers, that is, people on Capitol Hill and people in the executive branch, understand these issues, especially in light, for example, of what Mark Hetfield said last week about the real need for immigration reform. And it's not, to me, it's not just a matter of increasing the numbers. And I have to say, I don't know what that reform, what it would look like, but would it include more specific money to go towards the kinds of things that you've identified today? Do you know?
Yeah, that's an amazing question, Marilyn. That's again,
I'm a policy person, so that's why.
I mean, that's even better. I think that's what we need to be thinking of. So I can go on and present, what the issues are, and then if there's no policy or advocacy or community organization to back it up, it's really it falls short of what needs to be done. So to answer your question about whether the policymakers understand as it relates to healthcare specifically, whether they understand that. Um, I think it could be better. Let me just say that. I think more of an emphasis on public health professionals, medical professionals being included as policymakers. I think there's a big disconnect between people that have scientific or practicing knowledge, the practitioners, and people that implement policies. And yeah, that's a huge need in many, 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 many different regards.
Yes, I agree.
Yeah, that's a great question. Thank you.
Okay.
Yeah, I hope that answered your question. Did I miss part of that?
Yeah, I just hope that gets captured somehow as the people who are going to try to push forward on new legislation, that they would recognize that and incorporate it into the messages they give to lawmakers, for example.
Yeah, I absolutely, in terms of, especially when you think of, there's obviously different ways that, that could be implemented. That's why I sort of wanted to discuss like the bigger policies, like with ending family separation and detention.
Right.
And then the more community-based policies, because they're very they go together, but they're different.
Right.
And I think being able to look at the big picture and end very, very problematic practices that impact people's health, as well as addressing that you need to work in communities as well, to make sure that they have food access and housing and mental health support and medical support and language training. And I mean, so much of what HIAS already does in a lot of ways, that they have that and more. So I think, and a big scale and then a smaller scale.
Right.
Yeah, thanks. That's a great question. Thank you so much.
Okay, you're welcome.
Alana, I have a question. And thank you again for the presentation. It was really good. If I was looking, I do a number of things with highest, but I was wondering if I wanted to do more hands-on refugee work in the public health sector, what are my avenues? And then specifically, which ones are those linked to highest? Like, now that I have a better idea of what it is.
Sure. So I don't want to necessarily. I want to just say I'm I'm uh, I'm obviously working with Highest as a volunteer services intern. Outside of Highest, I'm doing more like health policy training and academic work. I absolutely would be happy to connect with you via email. We could talk about sort of there's definitely a lot of resources if SJ or Eleanor or anyone who wants to jump in to discuss sort of what that might look like for Hyas, please do so. But there's a lot of policy work going on. There's a lot of community organization, advocacy work, as well as just in general. I think public health is going through a little bit of a transformation in terms, especially with now everybody knows a lot of the terminology in public health. It's like center stage, and now everybody talks about herd immunity. And I think that'll only be to the benefit of public and global health. And it's almost like all my professors say we've moved into a different era. Like that whole, maybe I reference like PEPFAR, like when the United States was working with HIV and AIDS in Africa. We've moved past that. We're definitely in the COVID-19 and beyond era, which will look very, very different in terms of global health and public health. But also, to answer your question, there's a lot of work being done as it relates to climate refugees. I think that's one of the biggest. So, but if you know what I'm going to do, I'm going to just share my email. If anybody has questions after the fact, or I can send you some articles or resources or anything. I'll give. Okay.
And I just thought of something else based on what you were saying. Because of the future Biden administration's emphasis on climate, it seems to me that we would want to make sure that that emphasis, I know there's going to be a huge emphasis on clean energy, but I also think we want to make sure that things like the impact on populations of climate deterioration, that impact is somehow captured and will be addressed in any legislation that the U.S. or any policies that the U.S. puts forward.
I hope so too.
In the near term, hopefully.
I hope so. That's a great point. I think obviously we'll see it happen globally, but also, as you can imagine, there will be people displaced internally within the United States if any of the models are correct. So it's already happening.
It is, yes.
It's obviously very different than some situations, people fleeing from globally, but there are people already being displaced within this country. So
tribal nations, there are parts of tribes, and people in Louisiana are both groups are being displaced. Yes.
And thank you for mentioning both. That's absolutely true.
Okay, thank you.
Thank you so much. That's a great question. We're almost at time. I don't want to keep anybody over. Again, please feel free to send me a question or ask for more resources. Does anybody have any closing thoughts or questions? Okay. Thank you so much for coming. Really, thank you for being very interested in learning more about the population you serve and wanting to be better volunteers. Thank you so much.
Thank you.
Thank you. And have a good night and be well, everybody.
Thank you.
Of course. Have a good night.
Thanks, Alana.
Thank you.
Thank you, Alana. That was amazing.
Okay, awesome. I'll talk to you soon. I'll
Okay. Okay, great. Bye.